Hello, my name is Emma and I am a health visitor within the Hayward, Middleton and Rochdale area. Health visitors work with children and families where the children are 0 to 5 and also with pregnant mothers later in pregnancy too. It's important because we want all our children in this country to get off to a good start. There's lots of evidence that getting things right for expectant mums and children at this age improves children's health, well-being and ability to cope with whatever life throws at them, both in childhood and throughout their life as well. And currently, health visitors are needed more than ever in this pandemic and also afterwards to help pick up the pieces. We need more people to join our workforce and understand the vital work that we do, which is why I want to talk to you about this job today. All health visitors are nurses or midwives first. If, like me, you choose nursing, you can choose to specialise in children's nursing, mental health, learning disabilities or adult. I started my mental health nursing course when I was 21. Lots of people tend to go into nursing later in life than with most degrees, and I think a little life experience first can really help. The course in nursing or midwifery is 3 years, and then to become a health visitor you do an additional 1-year course. I've been a health visitor for 6 years now and a nurse for 13. A typical day might start off with me going to see a brand new baby at home with their family. This is a very special time, but it can also be a very difficult time as mums and dads adjust to their new role and learning how to understand what their baby is telling them, which isn't always easy. Babies are born communicators and they have the ability to learn any language in the world and speak it, but we don't always automatically understand theirs. So health visitors can help recognise or help parents to recognise their baby's cues, demands and needs, and support families to develop really close and loving bonds. After this, I might go and see a family who need quite a lot of support from a team of professionals. This could include families that have recently been subjected to violence, abuse, have special needs, or perhaps other high levels of need related to their health and well-being. Health visitors often form part of a wider team of nurses, healthcare workers, social workers or staff from children's centres to make sure all aspects of a child's and family's health needs are being met. After this, I might go and see a pregnant mum and listen to how she's feeling and talk about life after the birth. I always mention how important it is to keep baby close in the weeks after birth because babies need and thrive on close contact with their caregivers, and it's reassuring for them and it helps their brains to grow. Because health visitors come from a range of backgrounds, there are lots of skills that can be brought to the role and to the teams that they work with. As a mental health nurse, I feel well placed to detect postnatal depression or other severe mental health problems that can affect mums and dads after they have a baby. Advice to my younger self would be, I was quite troubled as a young person. I left school with no GCSEs. So I would say to myself or anyone else in that situation, don't worry if things are not going well for you at the moment. Don't give up. Most people don't know what they want to be when they're 16, 18, 45. Do what makes you happy. Don't give up. There's lots of routes into nursing. It's not just a standard, A levels and then the course. I did a GMVQ. There's also access courses. And one key trait to succeed in the world of work for me would be being a team player. Being positive and being nice to someone can make their day feel better. It makes you feel better. It makes everyone's work day more productive. It's just a win-win.